Of a highly drug-resistant bacteria called Carbapenem-resistant enterobacteriaceae. The Commission is expected to hold a press conference together with the hospital management. For more on the story, let's cross live to our colleague Chriselda Lewis. Chriselda, what can you tell us this morning?
Well, Desiree, we're expecting the Human Rights Commission to arrive at the Tembisa Hospital any moment now, where they will engage with the hospital management to get an update of what the situation is regarding the babies. Where I'm standing in at the moment is the neonatal ward, where the remaining 11 babies, who we understand the virus has now been cleared from their bloodstream, but they continue to receive a treatment or monitoring rather, because they are premature babies. There were 14 initially that were inside this ward, but 11 remain here now. They're being monitored basically for weight gain, and it was quite a long process for us to come in here, being sanitized by the hospital staff, giving us some of the protective gear before we're able to make it into this ward. You can see here just some of the babies that are receiving this treatment, or rather being monitored for weight gain at this moment. So the Human Rights Commission says it's here to get a clear understanding of exactly where the situation is. Has the hospital been able to clear any concerns relating to the Klebsiella pneumonia outbreak that took place between November and December? That's when the 10 babies had died. 14 then were also here, but you have 3 of those now that have been discharged, which leaves the 11 remaining babies right here next to me, who continue to receive monitoring for weight gain. But according to hospital officials, what they're saying is that the Klebsiella pneumonia virus, which was detected in them, has now been cleared. It can no longer be found in their bloodstream. I want to talk now to one of the managers of, the clinical manager for mother and child, Dr. Rihibulile Ncha. Dr. Ncha, thank you very much indeed for your time this morning. Just an update. We now know that there are 11 babies remaining here in the neonatal ward. What is their condition?
Thank you very much. So the 11 babies remaining are part of the ones who were infected during the outbreak. So in total we had 14, and we've managed now to discharge 3. So the 11 that are remaining, because these babies were born prematurely, they're basically here to receive care for weight gain, so that by the time they get to go home, they'll be of an appropriate weight for them to thrive at home. So majority of them here are really just here for weight gain, and that's all that we're monitoring them for at the moment.
Has the hospital been able to determine exactly what happened, that there was an outbreak of this Klebsiella virus? There's a lot of speculation that has been out there, accusations that the hospital is overcrowded, the need or the care that you need to give is to too many people with short staff. What causes an outbreak of this nature?
So there are a variety of factors that actually impact on an outbreak happening. Can be any type of outbreak. But looking at this current situation, our ward was definitely overcrowded at the time that the incident occurred, and obviously we also had shortage of staff. Now it's important for us to understand that there are multiple factors that impact on an outbreak actually occurring, and we need to be looking at patient factors, we need to be looking at environmental factors as well as hospital factors. So if you're looking at the patient factors, we know that our babies, they were premature, which means that their immune system is not strong enough, and they also had other things like their lungs were not well developed. So they already had some sort of comorbidities when they came to the ward, and that just increased their chances of getting any sort of infection. And obviously the issue of overcrowding, it really is a big challenge, because the babies are sort of close to each other. We don't have the proper distance between patients. So that also contributes to the spread of a virus or a bacteria. The issue of shortages of staff is also a big one, because we have a fewer hands on deck to attend to all the patients at the same time. And remember that neonates are really fragile, and they need proper care, and they need proper attention. So with the shortage of staff that we had, it really impacted on the complete management of our patient, and also predisposed the patients.
Dr. Cha, if that is the case, then you would possibly have people calling for the hospital to take some kind of responsibility for the deaths of those 10. I mean, how does the hospital feel about that? Because obviously you have 10 mothers who've lost their babies, notwithstanding, of course, the factors that you've alluded to. But some say something more could have been done to ensure that this situation never happened.
It's a bit of a difficult question to answer, but first of all, we have passed condolences to the mothers who have lost their babies, and it is not the intention of the hospital to lose babies in that way. But I think for us to understand the problem, we need to understand the entire value chain of the health system, because it's not an isolated case. So we really need to be looking at all the building blocks that build the health system and figure out in every block, what else can we do? I mean, more can be done. There is space for improvement, and we can definitely do more when we address everything.
Right, we'll wait for that meeting with the Human Rights Commission, together with hospital management. Dr. Helen Cha, clinical manager for mother and child here at the Tembisa Hospital. She'll also be part of that meeting with the Human Rights Commission as they try to come and understand exactly what happened during the months of November and December when 10 children died after contracting that Klebsiella pneumonia virus. So as it stands currently, 11 of the babies that are here behind me, we understand, remain in the hospital for monitoring. I think I'm going to try, I'm not sure if one of the mothers is still here next to me. I'll try and ask the hospital to see if they're able to bring one of the mothers, perhaps, that were able to speak to her. Perhaps we'll just wait for one of the mothers very shortly to speak to us. It's a few moments ago when we did an interview with them, Desiree. They're very distraught. Some of them have been here since November, where they say they gave birth, the babies were premature, and they say they count themselves lucky to be amongst the mothers whose babies are still receiving treatment at this stage. I'm going to try and see if the mothers of the babies who have survived here behind me will be able to join us in the next few moments. But I think the Human Rights Commission, would want to try and establish exactly what happened. We won't show the faces of the mothers. They've asked not to be shown on television. Ma'am, if you could come this way, please don't show your face. You may come towards this direction. We'll have a discussion with this mother. They've also asked us not to mention their names or their surnames as well. We'll respect that at this stage. Sisi, thank you very much for your time. How long have you been here? And I understand that your baby is one of the survivors of this virus.
Yeah, I've been here for a month and 3 weeks now. So, but all thanks to God, because my child has gone a long way. She has really gone a long way. So, but the doctors and the nurses are really trying. They're really trying their best. Though she was in pneumonia before, but right now she's been colonized and she's fine now. Just waiting on the weight. So everything is.
It must have been a difficult journey for you, because you were all here when some of the babies had lost their lives. And you must have been hoping that your baby would survive. It must have been quite a journey.
Yeah, it's quite a journey. Actually, I was one of the mothers of the baby that I had twins actually, but I lost one due to the infection. And I never blamed anybody or blamed the hospital for it. But what wants to happen has to happen. You understand? So it's just unfortunate actually. But all thanks to God, the doctors really tried, and the nurses also, they really tried their best. And right now the other one is well stable right now, so waiting for the weight gain. That's all.
Condolences to you, ma'am, for losing one of your babies. I think I'm going to let you go. I know that there's a process that the hospital needs to conduct with you currently. You may go this way. Please don't have a look at the camera. In fact, that is one of the mothers there, Desiree. She gave birth to twins and lost one of her babies, saying that she's counting herself lucky that one of her babies survived here. And she says she's not blaming anyone. But what is quite certain here, speaking as well to the clinical manager for mother and child, is that a lot more needs to be done to ensure that instances like this can be avoided. Perhaps in a later conversation that we can have with the Health Minister, we've heard that one of, while a whole lot of factors need to be taken into account, issues of overcrowding and short staff is one of the contributing factors, and perhaps if some of those issues are addressed, then perhaps the hospital will be able to avoid a situation like this. So the latest at the moment that we have, we're expecting the Human Rights Commission to arrive here any moment now, but just here next to me, 11 babies who doctors now say the Klebsiella pneumonia virus is now out of their bloodstream. They're just here for monitoring in terms of weight gain, because these are premature babies. So we'll hear what the Human Rights Commission has to say about perhaps whether the hospital itself should take some kind of responsibility for what has happened.
Thank you so much for that feedback, Chriselda. We'll try and reconnect with you as soon as the Human Rights Commission arrives there. You're